Welcome to Extended Families of Nebraska, Bloodborne Pathogens and Universal Precaution Training. This training meets the infection control requirements for staff and contractor training. The purpose of this training is to provide you information on Extended Family of Nebraska's workplace practices to keep yourself safe from bloodborne pathogen and airborne illness exposure, as well as safe practices for the disposal and decontamination of bloodborne pathogens and airborne illnesses. There are three main bloodborne pathogens. These include hepatitis B, hepatitis C, and human immunodeficiency virus. There are a variety of other pathogens that can be transferred from person to person to be aware of. These include herpes, ringworm, impetigo, scabies, and tuberculosis. Bloodborne pathogens are transmitted through contact with infected human blood and other potentially infectious body materials. Transmission can occur when an infected person's fluids come in contact with a mucous membrane or broken skin. Infectious blood can also be carried through acne, cuts, abrasions, and other open sores when there is contact with infectious blood or fluids. Some examples of modes of transmission include needles, personal hygiene equipment, body piercings, tattoos, sexual contact, skin punctures from contaminated sharps or needles. Universal precautions are the Occupational Safety and Health Administration's approach to controlling and containing the potential for bloodborne pathogens transmission in blood and other bodily fluids. Universal precautions ensure safety to all who come in contact with infected persons and help prevent exposure when encountering blood or bodily fluid. To stop direct contact with potentially infectious blood and substances, universal precautions may be observed at all times. It is important that every bodily fluid is considered potentially infectious and high risk when it comes to bloodborne pathogen scenarios. To protect yourself from infectious fluids or blood, you must follow exposure control plans through engineering controls, best work practices, and the use of protective equipment. Engineering controls isolate the employee from exposure to bloodborne pathogens and hazardous materials by physically changing an environment or instrument. A few examples include needle safety devices, personal protective equipment, biohazard symbols, safety cones, and sharps or waste disposal containers. Work practice controls are how tasks can be performed to reduce risk of exposure. These include practices such as not having food or beverage near where exposure can occur, avoiding handling of contact lenses, or recapping, breaking, or bending needles, implementing good hand washing protocol, and proper disposal of contaminated objects. Personal protective equipment, referred to as PPE, keeps you safe from blood, hazardous materials, and other modes of exposure. PPE includes face shields, CPR shields, gloves, goggles, gowns, and masks. When required, employees must wear these protective garments whenever they anticipate the likelihood of exposure. All personal protective equipment promotes safety by creating a barrier between you and the infection or hazardous material. PPE must be selected appropriately for each task and readily available. Employees should remove PPE before leaving the room and dispose of it in an appropriately designated container. The PPE you will most likely utilize when providing supports at Extended Families of Nebraska is gloves. This video will show you how to properly put on and remove gloves.
Today we're going to demonstrate how to properly put on and take off latex gloves. Doing this correctly is essential for effective protection. Before we start, remember latex gloves are intended for single use only. First thing, examine the gloves before putting them on to be sure there are no holes or cuts in them. A best practice, don't wear gloves over jewelry with sharp edges that could cut or puncture the gloves. Most gloves are pretty durable, but put them on carefully to ensure they don't tear. This is important. When removing the gloves, carefully remove them by the cuff rather than the fingers, and turn them inside out as you remove them. Remember, don't touch the outside of the gloves with your fingers when removing them. Dispose of them in the garbage. However, if the gloves are contaminated with blood, they'll need to be disposed of properly in a biohazard bag. Wash hands thoroughly afterwards. Take a look at our hand washing video for more information. Thank you and stay safe and healthy out there.
Washing your hands can help keep you healthy and prevent the spread of infections from one person to the next. Germs can spread from other people to surfaces when you touch your eyes, nose, and mouth with unwashed hands. Prepare or eat food and drink with unwashed hands. Touch a contaminated surface or objects. Blow your nose, sneeze, or cough into your hand and then touch other people's hands or common objects. You can help yourself and those around you stay healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Before, during, and after preparing food, before eating, before and after caring for someone who is sick or treating a wound, after utilizing the restroom or assisting with incontinence care, after blowing your nose, sneezing, or coughing, after touching garbage, or after you have been in public places and touched items or surfaces frequently touched by others. Washing hands with soap and water is the best way to get rid of germs in most situations. If soap and water is not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol.
My name is Lauren Hinkle. I'm an infection preventionist at Nebraska Medicine in our Infection Control and Epidemiology department. We're going to be showing you how to wash your hands with soap and water with the appropriate method. The Centers for Disease Control and Prevention says to wash your hands for a minimum of 20 seconds. I'll be showing you the World Health Organization's methods, which take about 40 seconds. Water temperature when washing your hands does not matter. What really matters is using the appropriate amount of soap and water and using really strong friction and rubbing your hands for the appropriate amount of time. Start by rushing, getting the soap wet and washing it over your hands. Interlace your fingers with your palm, touching the top of your other hand, and then switch to the other side. Place your palms together and interlace your fingers and rub back and forth. Rub rotationally on your thumbs and switch to the other hand. Cup your fingers and try and clean the tips of your fingers and your nails. Open up your palm and move with small little circles, and then switch to the other hand. Finish off the time by rubbing it all over your hands, and then you can rinse. Use a paper towel or something to dry it with. Dry your hands, and then use the paper towel to turn off the water. Hand washing is our best way to prevent infection. Using soap and water is preferable, but if you do not have soap and water in a sink handy, you can use hand sanitizer as a second option.
Another prevention method to stop the spread of diseases includes decontamination. This is the use of chemical and physical means to remove pathogens on surfaces. The most effective cleaner is a 1:10 ratio of bleach and water. Always wear gloves and allow 10 minutes to dry thoroughly. Remember, blood and other bodily fluids may be present even when you do not see them on the surfaces. To dispose of contaminated objects that may contain disease is important to help stop the spread as well. All containers or bags should include a biohazard waste symbol, and products should be disposed of properly. The following are examples of waste you should not throw in the garbage: contaminated items that could potentially contain blood, contaminated sharps, or any item containing dried or fresh blood. If you have been exposed to blood, or objects that have potential to contain disease, you should use soap and water to wash the parts of your body contaminated. If an exposure happens at work, you should report this incident to your supervisor and follow further instructions. You can catch some diseases simply by breathing. These are called airborne diseases. Airborne disease can spread when people with certain infections cough, sneeze, or talk, spewing nasal and throat secretions into the air. Some viruses or bacteria take flight in the air or land on other people or surfaces. When you breathe in airborne pathogenic organisms, they take up residence inside you. You can only pick up germs when you touch the surface that harbors them and then touch your own eyes, nose, or mouth. Because these diseases travel in the air, they are hard to control. Some airborne diseases include influenza, measles, tuberculosis, the common cold, mumps, and COVID-19. Although it is impossible to completely avoid airborne pathogens, there are some things you can do to lower your chances of getting sick. Avoid close contact with people who have active symptoms, stay home when you're sick, wear a face mask to prevent spreading or breathing in germs, cover your mouth when you cough or sneeze, use your tissue or an elbow to cut down on the possibility of transmitting germs to your hands. Wash your hands thoroughly and often, and avoid touching your face or other people with unwashed hands. On March 11, 2020, the World Health Organization characterized COVID-19 as a pandemic. COVID-19 poses an especially high risk for the elderly and people with pre-existing health conditions. It has caused severe illness and death worldwide. Because of the individuals we support, many being in the high-risk category, Extended Families of Nebraska has taken several precautions to protect those we support, as well as staff and contractors. Face masks are required when providing close supports and when you are near others. Maintaining social distance when space allows, the recommended 6 feet minimum. Staying at home when you're sick. Practicing good hand washing techniques, and the utilization of hand sanitizer when hand washing is not possible. If you have been exposed or are going to be tested for COVID-19, it is important to contact your supervisor prior to coming into work. COVID-19 can cause mild to severe symptoms, and some people can be asymptomatic carriers of COVID-19. Symptoms to watch for include fever, cough, shortness of breath being the most severe. Other symptoms may include sore throat, runny nose, body aches, chills, headache, fever, nausea, diarrhea, and the loss of smell or taste. If you or someone you support is experiencing any of the above symptoms, you are encouraged to stay home. Most people will have mild symptoms and should recover at home. However, if you or someone you support experiences difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or the inability to arouse, or bluish lips or face, you should seek medical attention immediately. Americans are increasingly adopting the use of cloth face masks to slow the spread of COVID-19. Masks should be worn correctly to help prevent the spread of COVID-19 and other airborne illnesses. Wash your hands before putting on your mask, put it over your nose and mouth, and ensure it is secure under your chin.
Sam's patient has an upper respiratory infection. Sam knows what to do. Sam puts on a mask and enters the room. Sam? Sam performs hand hygiene. Sam secures her mask either with ties or by placing elastic ear loops around her ears. She fits the flexible band to her nose bridge, making sure it is snug to her face and below her chin. Sam knows her front of her mask is contaminated. Sam performs hand hygiene. Instead of touching the mask, she grasps the ties or elastics of the mask, carefully removing the mask without touching the front. Sam discards the mask in the waste container. Sam performs hand hygiene. Great job, Sam.
Now that you have completed the Bloodborne Pathogens Universal Precautions training, the final step is the completion of the online test. Please click on the link located in the description section of this video. You must receive an 80% to pass. Upon completion, you will receive a certificate of completion using the email address entered on the test. If you do not pass the test, you will be contacted by your coordinator for additional training instructions.